Start. Want to start.
Yeah, start.
Leave it alone now.
Okay.
Leave it alone.
Okay. All right. I think we did it. Hi, Perry, says Cheryl. Phyllis in Oklahoma. Rebooted. Good. Hi, everyone. Yeah, I think I did it wrong. I don't know. I clicked the wrong place. I do it right most weeks. Didn't do it right today. Oh, dear. Offline already. Same here. Offline here, too. Yeah, something else must be. Okay. Is that Instagram? I think it could be Instagram. Same here. Same here. Rebooted. Same here. Greeting from hi from Oregon. Okay. So can you hear me? Let's just see. Is everyone showing up? Back on. Back on. All good now, says Franca. And Fernicia says, I can hear you now. Okay, good. Things are moving along. That's all we really want to know. Are things moving along? It's really good. All righty, friends. Let's see. Yes. There are a couple problems. Anyway, we're going to start anyway. We're just going to go. Hi, friends. My name is Joette Calabrese, and I do one thing and one thing only every Monday at 8 o'clock Eastern Time, and I talk to you about homeopathy. And I like to see you share with each other. I love to see what you're doing. I like to hear about how you're helping each other. I like to know where you're from, too. It's always fun for me to see that. And so for those of you who already know me, welcome, my friends. It's great to see you all. Barb's from Grafton, Ontario, and Oakville. And hi from Debbie in Pennsylvania. Always love spending time with you. Thanks, Debbie. Let's see what else. Hi, everyone. Don't forget to like, comment. Thank you. That's someone. I don't know if it's Natalie is here or Shamara. Not Shamara. Serena. Okay, from Maryland, Massachusetts in the house. So happy to make it this week, says Teresa. Hello from Tammy in Montauk, Ohio. Great. Okay, everybody's good again. Missouri. Excellent. Let's talk, shall we? I've got some interesting information here that I've been kind of putting together for some time. And I particularly am interested in this subject, not because it's necessarily because it's alpha-gal syndrome, but I guess let's put it this way. I question maybe not all, most medical theories. I question diagnoses. I question theories. I question the cause of illnesses that has been determined by the general medical world. I don't go by what I'm told, or at least I try not to. I know I've been tripped up many times, and that's why I question now more than ever. So I'm going to approach this from kind of two angles tonight regarding this alpha-gal syndrome. And so let's start with that information, knowing that I question, and I believe that you question too, or else why would you even be here? Because if you believed the status quo, you would just, if you were worried about alpha-gal syndrome, you would just take antibiotics, right? Stay away from red meat, from dairy, from, ruminant meat. You would just stay away from it and just go ahead and follow what the doctor says. But there are some other ways to look at this. But before we go into the alternative ways to look at it, let's talk about what it's called alpha-gal syndrome. And what a syndrome means that there's a cluster of symptoms, that they are more than three is usually, I believe that is the definition. You have to have more than three symptoms to equal a syndrome. And so we know that it is called a syndrome because there are a lot of symptoms that go along with this. What are those symptoms? Fever, fatigue, muscle joint pain, headaches, lymph nodes that are swollen, I've got some notes here, so I'm going to keep looking down. Rashes. There can be hives. There can be anxiety, joint pain. Lots of conditions that could be associated with this. Oh, yeah. Angeline says, I was part of the medical establishment for 30 years. I question everything now. Yeah, you can't help it because there are entities behind the most common answers. So anytime they say, well, it's determined, this is the cause, that's when you question. You sure about that? Well, it's determined. This is the solution. Are we sure about that? We've been burned too many times, as Angeline says. And so I'm going to look at it slightly differently tonight, but I'm also going to give you a solution, which I think is gorgeous, which is always homeopathic. So I follow the work of a number of medical doctors and many of them researchers who also question. And those of you who don't know about these two people and their group, they are Dr. Mark and Sam Bailey. And I've actually gotten to know Mark Bailey. And they believe that Lyme disease, and by extension, any tick-borne disease, is not really legitimate. Not that the person isn't suffering. No, that's not what they're saying. But that it is not a legitimate or specific infectious disease, say caused by Borrelia or Burgdorferi, transmitted by ticks. They believe that instead it's a pseudo-scientific germ theory that mislabels this nonspecific range of symptoms. What are the symptoms again? Fever, fatigue, muscle joint pain, headaches, swollen lymph nodes. Should we keep going? Rashes, hives, etc. I hate to say this, friends. Most illnesses, or many illnesses, I perhaps should say, include those symptoms. So, so how do they determine whether or not someone has gotten this alpha-gal disease? They go by symptoms. The person describes their symptoms, and then the doctor if the doctor is up on this, says, okay, this could be this, could be a number of things. So then they test. And then it shows that indeed there is a bacteria. However, they're saying that the Baileys and others are saying that that this bacteria is concomitant, found automatically in the gut of certain ticks, Lyme tick and alpha-gal tick. It's not alpha-gal tick. It's called, what's the name of this tick? Lone Star tick. And that that no spirochetes are detected in the blood or the skin after the bites. It's only found in the insect. And then later papers were claiming isolation from patients were rare and low density and didn't prove cause and effect. Now, this might really irritate some people because they're saying, well, I'm sick. What could the cause be? Well, I'm going to tell you, friends, just because we don't know the exact cause doesn't mean we don't know what to do. So I want you to think in terms of that person can still be quite sick. Okay. M2 Me Too says a Lyme disease is not caused by bacteria from a tick bite, but rather by a low-grade viral infection, primarily the Epstein-Barr virus, which causes symptoms that are then misdiagnosed. It's another theory. I think the whole virus theories are indeed theories. So that's, let's consider all the possibilities, shall we? But really, when we're talking about this, do we need to know the etiology? Do we need to know the exact cause? That's the big question. Now, when someone gets bit by a tick, they've got a tick stuck on them. At that moment in time, we automatically in homeopathy know that we use Leadum 200C. That's just a given. Whether or not it's carrying a bacteria, whether it isn't, whether it's a virus, it doesn't. We just do it because we do that for insect bites, insect stings, animal bites, rat bites, dog bites, even. And so it makes it easier being a homeopath, not needing to find out exactly what's going on in terms of the cause, the etiology. Instead, my friends, we prefer to use the symptoms. And so in Lyme disease, Lyme tick disease, what are the symptoms? Joint pain? Let's use a joint pain remedy. Now, we're not just treating the symptoms, we're using the symptoms to determine what medicine to use. So let's go back. Let's think about Dr. Samuel Hahnemann, who came up with this with homeopathy in the 1700s. The microscope was only just devised around that time. They didn't know what they were looking at. And if someone came to him and said, I have fatigue and fever and my joints ache and I've got hives and I've got a rash, etc., did he say, oh, we need to find out what the cause is? The beauty, the brilliance of homeopathy, my friends, is that we can base it on symptoms. Now, we can use the name of the condition as well. But if this condition is vague or we're not really sure, we can just use symptoms. And in fact, that's exactly what we do. We start with the possibility that indeed this could have been caused by a bite. Hence, Leadum 200. And we use it that first day of the bite, the day you get the bite. Or the next day. Maybe you don't find the tick for 3 days. And then it is found, and then that's what the tick is removed, and the Leadum 200 is commenced. How can homeopathy help with tick-borne illnesses? Just like it helps with cancer and broken bones and schizophrenia and eczema and rheumatoid arthritis. It does it exactly the same way. It stimulates the body's natural ability to uproot or at least address the condition. So, let me just say that instead of diving into the cause, hold on to it if you need to. If you feel comfortable doing that, that's fine. The cause, okay, it's associated with the bites from the Lone Star tick, as well as potential others. It's just that's the one that's the most well known. So it shows that there's IgE antibodies, the alpha-gal specific IgE antibodies. Well, are we sure about that? Okay, so this is fabulous. I'm watching as somebody is answering. Bernie says, there is alpha-gal in our family. We use histaminum and natmur to help with the symptoms. Now, here's the thing with homeopathy. We're not just treating symptoms. In fact, that's not what we're doing at all. I'm going to say it again, using symptoms. Symptoms are king. Symptoms are everything. So whether the disease is from a tick bite that is carrying a bacteria, or it's from pesticides that were sprayed in the neighbor's yard yesterday and you were exposed to it, or it's from eating bad chicken at a restaurant, or it's from rheumatoid arthritis indicated by the tests, or it's from having just had a pregnancy that was particularly difficult, or it was from, could we keep going? Or it was from a urinary tract infection that was treated with an antibiotic. If the symptoms are thus, and thus, we use the same medicines. And we are not treating symptoms. That the reason people have a hard time understanding this is because that's what conventional drugs do. They treat the symptoms. They say, headache, acetaminophen. No. We don't do it that way. We want to know, what do you mean headache? How often? Where is it? Which side? Is it throbbing? Is it aching? Is it pressing? Etc., etc. So listen to all of these complaints that are, I don't mean complaint in a negative way, but all of the symptoms that people are talking about here. That there's nerve symptoms involved, there's anxiety involved. So let's use what we know. If the person is getting, whether we call it alpha-gal or Lyme or rheumatoid arthritis or food intolerances or ailments from eating red meat or matters not. We're going to use the same symptoms. Now, we can look up in our repertory. And let me just hold on. Let me just get this up first. Let's just see here. There are common symptoms that are across the board that some people, all people, or many people have. There are more lesser common symptoms. There are extreme common symptoms, etc. So, as Gil says in Finding Nemo, he says, all drains lead to the ocean, kid. Here we go. We're going to the repertory. We're going in and we're going to find out what remedies we use specifically for ailments from beef. Beef aggravates. I'm on page 974 in the Meta Repertory, the 4th edition. Okay? There are a lot of medicines here. But if we know our materia medica, after we've looked at these, and we look at some of these medicines and we say, one of the top medicines is nux vomica. Another one is sulfur. Now we also can look at, did I lose my place? Goodness sakes. I hope I didn't. I think I did. We can also look at not just beef, but we can look at meat. And look at all the medicines that are specific for ailments from meat. We could use one of those medicines. But what I like even better than that, or in conjunction with that, is how is it presenting? What are the symptoms? Oh, he has nausea and vomiting every time 6 hours after eating lamb. Oh, got it. Could it be alpha-gal? Yeah, could be. But what if it isn't? What if we're wrong about that? What if the test is erroneous? Can we still use a homeopathic medicine? Yes. We're going to use medicine that's specific for that. What if he has nausea and some vomiting 6 hours after eating meat, and he's irritable, and he also has constipation? And right here it says ailments from eating beef, and we know that that's one of our main medicines for this. We could use nux vomica. I mean, why not? If we know that he was bit by a tick, we can still give him Leadum 200. We're going to start with that, okay? Uncle, I concede. Okay, let's just say that's what it is. But now we're going to go after what is happening to this particular person. So fatigue, mental and physical. If that's, Tammy asks, what about fatigue, mental and physical? What are our great medicines for fatigue? If that's all we don't have any other gastrointestinal symptoms. We don't have any hives. We don't have any rashes. We don't have any joint pain. All it is fatigue, mental and physical. Then we're going to use a fatigue medicine, one of our great fatigue medicines. What might that be? China 200, which is also known as cinchona bark. We could use phosphoric acid 200. Yep. And Eagleston says, isn't there a root cause, though, for every ailment? Absolutely not. Shouldn't we go to the root of symptoms? Really, how do you know you're right? And if you try to go to the root cause and you're wrong about the root cause, you've wasted a lot of time. I'd rather go directly to how the person's suffering. Think about it that way. But think about it that way, Eagleston. Think that way. Yes. Because root cause is lovely if you can figure out what it is, but what if it's, as according to doctors Sam and Mark Bailey, it isn't. The root cause isn't from a tick. And now what have you done? Now you've had antibiotics and you've wasted a lot of time. Instead, let's go directly to how it is presenting. And how is it presenting? This person has terrible constipation. Oh my gosh, the constipation and the fatigue is terrible, and they're irritable, and they're waking up at night around 3 a.m, and they find all they want to do is eat stimulating foods. They need to drink more coffee, and why not try nux vomica? So as much as I would love to give you a specific protocol for this, I'm going to back off and say, my friends, I think it's specific to the person. What are they suffering? What are they suffering? Okay, so Joette, my daughter went to a functional practitioner with symptoms of Lyme, such as chronic fatigue. Why not just use a chronic fatigue remedy? Systemic yeast is chronic fatigue. Food intolerances causes chronic fatigue. I mean, listen, these symptoms are so common, my friends, that I think it's a little too broad. It's like when somebody goes to what are they called? Someone who reads the globe and for goodness sake, someone who reads the future. I can't remember what it's called. And they get a feel for who you're all about, how you're dressed. They ask you certain questions. And after a while, it looks like they know all the answers. They have all the answers to your life. And really all they did was just pick up on what you told them. So, I've been diagnosed with Lyme for a few years ago. 2 days later, the doctor's office contacted me to say, never mind, it's not Lyme. So what do we think it was? Go by the symptoms. Do we absolutely need to know the name of the condition? No, I don't think we need to know the name of the condition. I don't think that's so. The homeopathic nosodes of the tick diseases really help me. Great. Then by all means use that. Because I know that Borrelia can be useful. It has been useful, but not for everybody. Yes. Okay, Laura says, yes, arsenicum album has helped spider bites in the past. I was low on arsenicum album, says Laura. Psychic. Thank you, Robin, the woman who reads the globe, a psychic. I had a bite, though, that I thought might be a tick. Back of the thigh and could not see it well. Ledum didn't touch it. Well, ledum is only the start. It doesn't mean that it actually does the whole thing, but we start with ledum. At that moment in time, fortunately, it just skipped up. Sorry, let me see if I can get back to that. I had Aurum arsenicum that did resolve it. Not sure how to repeat a mixed remedy, but I had written on the label poison infection. Might have been a spider bite. Yeah. Aurum arsenicum, absolutely. Not sure how to repeat it, whether it's a mixed remedy or it's not a mixed remedy. It's still repeated in the same fashion, Laura. Okay. But Joey, don't you tell us to get a diagnosis? It is frustrating that many people don't want to go to a doctor, so I have to go by their symptoms. Get a diagnosis. What's the diagnosis? What is the... You're talking... Root cause is different than diagnosis. Doc, my joints hurt. Doc, I'm fatigued. The doc writes, chronic fatigue and arthritis. Those are diagnoses. That's the diagnosis right there. Before there was such a word as Lyme, back in the 60s instead of the 70s. And somebody went to their doctor. They got the diagnosis written up. You've got chronic fatigue. Well, in those days, it's chronic fatigue and joint pain. This person is suffering from arthritis and chronic fatigue. Why don't we use the medicines for that? Because remember, my friends, homeopathy is older than these names of diseases. So we use what we know. What do we know? The exact symptoms. That's what we know. Well, there are a number of chronic fatigue remedies, and I said China's one, phosphoric acid is another. There are a couple of them. Those are the top two that I think of. But listen, Nux vomica can have chronic fatigue as well. Yeah. Teresa says quite often the name is based on symptoms anyway. This is why everyone needs to go through your academy, Joette, says Elizabeth. Thank you. You're right. Right. Okay, my husband got bit by a bee. Hand swollen, gave Ledum 30 and Apis 200 every 15 minutes for the first hour with a small change. So we switched to Apis 1M, no change in edema. Sometimes itchy, so gave arsenicum, when itching presents. Should I be doing something else or just be patient? No, you should. If the medicine is acting, then you carry on. Perhaps you're not using them frequently enough, depending on how severe the condition is. If you're giving it, I don't know how often you're giving it, but and my mighties, if you're in a mighty, I think you're Hi, Joette and Mighties. Yes. Okay. So you can ask that question later with more information when we go to my Joette's Mighty members in about 5 minutes. Do you have kit recommendations for a baby shower, bridal shower, college send-off, military send-off, etc.? I would love to hear your thoughts. Well, Melissa, I'm putting together a kit just as we speak, pretty much. It should be out. Well, we keep saying, sometime in July, but we don't know. It's going to be Boron will be manufacturing it, and so that's a kit. But if you need it sooner than that, I like Washington's kit. I like Helios's kit. Okay, how about mental states? Well-known homeopaths in India and doctor within Greece go by them. If there are mental conditions. Don't use a mental state if there's no mental condition, my friends. You're just going down a rabbit hole that you may never come out of. I used that method myself many, many years ago, using only the mental symptoms. Good luck. That's a very classical method, and I prefer to use the name of the condition, arthritis, fatigue, or in another person's case, it might be hives that are worse in bed, or another condition. See, when you're getting bumps all over, what is this? What is this? Go to the doctor. The doctor says, the diagnosis is you've got urticaria. That's a diagnosis. You knew that anyway. So you use exactly what's presenting. Now, if there's a reason to use the mental state, if before the person got sick, they lost their job, or they were shamed, or they lost their dog, they had terrible grief in then they were shamed, they lost their job, we consider staphysagria, of course. If the person just lost their dog or have had terrible reversals in their business, we might use ignatia. Or in the next case, maybe aurum metallicum. So yes, we're going to look at that. Of course we look at that if that's part of the picture. Do you suggest going through 30 days of antibiotics after an infected bug bite? Do what you want. What do you think I would do? What do you think I would do? How about, okay, let's see what else we've got here. Let's see. Wow, these are coming fast and I have to catch up. Let's see. I don't hear an echo. No echo. Okay. Love the Helios kit, says Debbie. They're a good price. I've given the Helios first aid kit. There we go. We're helping each other. For spider bites, I just... an old homeopathic would tell people to take a little bit of the material from the bite area. Yes, you can do that. Use it to make your own homeopathic. If it worked for a friend who lived hours from a hospital, yes. Otherwise, you're going to keep... No, what you're really going to do is keep a kit on hand. You want a homeopathy kit with spider bite remedies that you're going to use perhaps on the way to the hospital. I don't think you'll need it, though, once you learn how to use this. Let's see. Antibiotics cause too many gut problems, says Robin. Well, we're lucky if it's just gut problems. Because by gut problems, most people think, oh, well, I'll just eat some yogurt. Or I'll take probiotics for a while. Really? Are you sure about that? You look at your own timeline and look at what occurred when. Oh, I had that urinary tract infection, or I had that pneumonia 10 years ago. I've never been well since. Things are just not the same. Was it the urinary tract infection? Was it the pneumonia infection? Or was it the treatment of those two? Because now this person can't have dairy anymore. This person can't have grains any longer. Can't have wheat. They get very sick from it. Was it from the disease that they got, or was it the treatment of the disease? Let's see. Any help for carpal tunnel? Yeah, I've written about Joette Calabrese carpal tunnel. You'll find it. I've written about it. Now, what if the person found a tick and they removed it? They took Leadum 200 that day. Okay, and maybe they took it for a few more days after that, the way that I teach how to use these Leadum for a tick bite or any kind of insect bite. And now, not long after, maybe, 4 months later, they have carpal tunnel. They've forgotten all about the tick, but now they have carpal tunnel. Do we treat it differently because of the potential that this might have come from a tick? Or do we use the carpal tunnel protocol? We use the carpal tunnel protocol. It's actually, my friends, this is so easy that it's hard to believe, right? Isn't that so? We think, what? Really? You just use the same? Yeah, you use the same medicines. Whether the joint pain or the fatigue are from a tick bite, or the bacteria from a tick bite, or from the pesticides next door, or from going through menopause, or from eating the wrong foods, or from heavy sorrow in their lives. It doesn't matter what the cause is. So that root cause business, it can be useful sometimes, but we don't focus on it. I like the analogy someone used regarding taking conventional drugs. It's like making a Faustian bargain. You seemingly get what you want in the here and now, but then the piper has to be paid down the road. You're right, Elizabeth. Put it in a jar in alcohol for a couple of weeks. Shake and succuss and apply topically. Oh, I don't know. I would make it into a homeopathic. I would dilute it a few times. But could you do that? I've never tried it that way. I have made medicines out of substances like that, but I've made them into homeopathic medicines. Can ledum be used for heartworm prevention? Let me just say this. No, I wouldn't. That's not what I would think to do. There are wonderful homeopathic vets out there who talk about how to use particular homeopathic medicines for heartworm. And there was someone here tonight. Let's see if she's here. I'm hoping that she is. Let me just take a quick look. Who works with animals. Come on, where is she? I don't want to mention her name unless she's here. I thought I saw her. Neely Piazza. Neely's here. Neely Piazza is right there. If you want to scroll up and look at her, she's Neely Piazza works with dogs, and she has a very good reputation. Okay, here we go. Mindy says Helios sells a heartworm dog medicine. Oh, let's see. Yeah, and Harry says for carpal tunnel, research Ruta graveolens. Whether the carpal tunnel is a result of a bacteria infection, a bite, a dog bite, an unhappy overuse, a pianist who overuses their wrists and their hands. Still Ruta. It's not the only one. We have causticum. We have others as well. Hypericum, certainly. But listen, my friends, we use the top medicine for the specific condition. We're not looking for necessarily for the root cause. Okay. Dr. Pitcairn, someone said. Dr. Pitcairn is a veterinarian, a homeopathic veterinarian. Any suggestions for severe constipation for a 14-year-old female that relies on laxatives and mag citrates? Joette Calabrese, constipation. I've written about constipation a number of times. I mean, 14 years of writing my blog every week. It's free. It's all free, my friends, and there are all the answers right there for you. I'm not telling you that it's an absolute. I give you the top medicines that are the most commonly used in these situations. Oh my gosh, it's 8:35. I think I have to go.